For more on diphtheria outbreak in Nigeria, we have Vice President, Medical Initiative for Abuja, Dr. Agbor Ebuta. He joins us on the news this hour. Thank you so much for joining us on the news. Knowing that this is a highly contagious bacterial infection that can be fatal without treatment, what's your assessment of Nigeria's response to the rise in cases of diphtheria in the past week?
Well, diphtheria, we've heard the headlines and all of that. Nigerian response so far has been, it's worth recommending because to a large extent, they have been able to set up a task force consisting of the Center for Disease Control and the Primary Healthcare Development Agency. This is basically because you need to be monitoring the progress of the infection in the population, and you also have to put in place response, recovery, and mitigative measures. The major problem why we have this situation in our hands at the center of it all is because of the low vaccination coverage. Totally in Nigeria, percentage-wise, we are looking about 57% coverage, meaning that 43% of those who should have been vaccinated against diphtheria were not vaccinated. These people are susceptible and they have accounted for most of the people affected. So we need to match diphtheria. We need to match effort for effort. We need to up our vaccination numbers. And the minimum vaccination percentage we require in all of these areas is as much as 80 to 85%. That is what will give us what you call herd immunity. So in areas like Kano, in Kaduna, in Katsina, in Borno, in Yobe, in Bauchi, which have accounted for 98% of the cases suspected and confirmed currently, we need to drive up the numbers as soon as possible. In addition to driving up the numbers, which will protect the community, we need to be able to provide information to healthcare workers on how to respond, how to treat, how to determine, how to make diagnoses, and then to provide the necessary consumables in terms of medications that are required. A very essential commodity or consumable that should be provided, and I am aware that the task force is working on that and has deployed some of that, is what you call the diphtheria antitoxin, which is required to prevent the life-threatening complications of diphtheria. Because diphtheria is not simply about the upper respiratory obstruction. It can also cause kidney failure, heart failure, and permanent damage to nerves. And what will mitigate that is the diphtheria antitoxin. And the government, I hear, is making efforts. So all we need to, on the other hand, the populace would basically need to support government. Traditional institutions would need to talk to their people. Religious institutions will also need to talk to their people to reduce vaccine hesitancy, which is a major problem.
Doctor, I was going to ask you that in the past week we saw about 7,200 cases. Any reason why we see these increased cases in Kano, Yobe, Katsina, and other northern states? Any particular reason that we should look out for?
Yes, in these regions, in these states, vaccination uptake is very low. Overcrowding is very common. Access to healthcare in some of the local governments are also very challenged. And apart from that, close interaction, the absence of physical distancing, which is a key factor in reduction of aerosol transmission, aerodroplets transmission, borne disease transmission is also a challenge. So, and also we've also noticed that in the last couple of weeks, children have gone back to school, and these are the population that are mostly affected. They play very closely with each other, and they don't know what you call cough etiquettes, which is a measure that you can use to mitigate this transmission. So the numbers would keep going up, except we match it. And in matching it, we need to up-regulate vaccination. And the new position of the federal government, which was clearly stated in the task force bulletin yesterday, was that we are encouraging state governments to reinstitute the use of face masks, physical distancing, and high level of personal hygiene, like hand washing, which will reduce the transmission. I mean, this is aero droplet transmission. It's just like COVID transmission. So those same measures, non-pharmacological measures that we instituted, they will go a long way in mitigating transmission significantly. Health education is critical, and we cannot fold our hands any longer.
Vice President, Medical Initiative for Africa, Dr. Agbor Ebuta, thank you so much for enlightening us on the outbreak of diphtheria in Nigeria. Thank you for joining us on the news.